Hi, it's Dr. Cordy again. I'd like to talk a little bit about what kind of diet works best for patients who have PCOS. Typically, when I see patients who are struggling with hormone imbalances, they're often skipping breakfast or they're skipping meals or they're having really low fat kinds of things to eat way too frequently. And I think one of the things we really need to recall or remember about hormones, which is this big hormone dysfunction we have with PCOS, is that hormones are made from cholesterol and they're made from minerals. And so we need to have enough of these things. And cholesterol is generally found in foods that are fattier and are from animal products, just by nature of what cholesterol is. It's the lining of membranes in animal products. And so if we're going to create good, healthy hormone balance, we need to be supplying our body with the good raw materials that those things come from. So high quality, well fed, and pastured animals are really the way to go when we talk about getting good quality proteins and fats into our diet. But fats also includes things like avocados and nuts and seeds and oils like avocado oil, olive oil, macadamia oil, ghee, butter, coconut oil, palm oil. All of those are really stable. They're very, very good for us. And they really help balance out the oftentimes the fat that we remove from the animal products that we eat. And so we can have more fat, and sometimes we just need to add it back in by using more of those fats rather than eating kind of gristlier cuts of meat. Not all of us really like those, is what I find. And so if we can add more of these oils back in to balance out the oil that we removed or the fats that we removed when we butchered or when we kind of cut off the gristle or cut off the skin, although I think they're good for you, especially when they're coming from well-raised animals. Um, the fat that's in there is really good for you. But if you don't like the texture of them, we do need to be adding that back in. So fats are really, really important to add back in. We can use lots of olive oil. The more the better. The more research we see about olive oil, the more we have it, the better it is for us. And so I think to add that to basically on top of almost everything we have is really helpful. It's nourishing, it feels good, it tastes good, and it helps us feel full after a meal. And it helps the flavor of a meal, so we're really enjoying what we eat. And then in addition to those things, definitely focusing on colorful vegetables is important. The greener and the darker red and the darker orange, the more nourishment or nutrients are going to be in those foods. And when we do any kind of food that's really colorful, adding oils to those are also helpful because some of those nutrients are fat soluble. So we need it to ride in on fat so it can get around to our tissues so our body can actually use them for energy and get those minerals to the right places and the vitamins and provitamins to the right places so that they can be made into vitamins, kind of like beta carotene is made into vitamin A. So that's a provitamin. That's a good example of a provitamin. But we also want to look at just really drinking enough water. It seems super simple to say that, but I can't believe how many people are simply water deficient. And there are all kinds of problems that result from that. They have backed up liver toxicity. They have really, really sluggish bowels. Their skin is dry, their tissues are dry, and they wonder why that is. And it's just that they're simply not drinking enough water. And so waking up in the morning and starting with 1 or 2 pints of water is a great way to start your day. And then throughout the day, really doing that 3 or 4 more times to get enough water in all day long is an easy way to at least get yourself hydrated, like bare minimum, just hydrated with water. And then balanced proteins and fats, breakfast, lunch, and dinner. Again, aiming for like that 20 to 30 grams. Some people don't do very well with a lot of fruit. I don't think many people do well with a lot of fruit. I think some people do okay with some fruit. And some people don't really do very well with any fruit at all because it is fructose. Fructose can challenge the liver, it can be hard on it. And we need to be careful of it when it comes from a whole food natural source like blueberries or berries or apples or pears or cherries, like fruit that grows where it snows is what I usually tell my patients. Those are the safer ones. I just don't want you to overdo it with even any of those that are really good for you because I want to make sure that you have lots more vegetables than fruit. But I don't necessarily want to cut fruit out because I think there's lots of goodness in those fruits from the polyphenols and again the nutrients that are found in the brightly colored berries and cherries that we can get. And we can add that really as a dessert to lunch or a dessert to dinner, and it works really, really nicely to make sure that we're getting enough and really satiating some of the sweetness and the sweet cravings that come along with PCOS that are very significant. And so if we can nourish and calm your blood sugar handling system by making sure we're giving you enough fat and protein regularly, and then sort of calming or quieting that sweet tooth by having some dessert with fruit after lunch or dinner, that generally, again, is a good way to start showing up to a really good balanced diet. And everyone's going to be a little bit different. The kinds of things you grew up with, the kinds of things you're now doing, the behaviors and patterns around food, how you cook, when you can cook, if you can even cook at all for yourself, or if you have to grab something on the go. And all those things on an individual basis we can solve, but starting with protein and vegetables, some starchy things, but not a lot, and starchy things coming from roots and tubers and other kinds of vegetables like that. And then some fruits as desserts after lunch or after dinner. I find that really works best. So this is just a general outline or guideline for what I see works best, but I really think that one of the most common things I see people fall short of is enough good fat and enough protein, especially at breakfast time. So take a look at what you're doing and see if any of this helps or any of this starts to guide you in a better direction. And hopefully this is a little bit helpful and you learned something, and we'll see you in the next video.